Hi, my name is Mehdi. I want to talk about different ways of controlling the third order position of tooth in edgewise technique. If you like this video, please give me a thumbs up to increase the visibility of this video and subscribe to my channel for further orthodontic videos of this type in the future. First, let's see what's the first, second, and third order position of teeth. When the teeth are viewed from the occlusal side, the buccolingual position of teeth are called the first order position. In traditional orthodontic brackets, these bends on the arch wire was meant to make the correct first order position of teeth. In contemporary straight wire brackets, the thickness of the base of the brackets and tubes compensate these bends. These bends are lateral offset, canine turn, bayonet bend in front of the first molar and second molar. When the teeth are viewed from the buccal side, the angle formed between the long axis of the teeth and the perpendicular line to the line of occlusion is called inclination or the second order position. Nowadays, these inclinations or aesthetic bends are also incorporated in the prescription of straight wire brackets. And finally, the third order position of teeth or torque can be viewed from the mesial or distal side. As you can see, for the posterior teeth, the third order position of teeth makes the curve of Wilson. Now let's have a look at different methods that we can use to control the third order position of teeth in edgewise technique. The last two methods are designed by myself, and the other 5 methods are currently used by many clinicians around the world. As you can see, engaging a rectangular arch wire into the bracket slot, which is also rectangular in shape, can change the third order position of teeth. However, there are a few limitations to this method that we are going to go over them one by one, then review other methods. Now first, let's jump into the very first method, which is the most popular and most common way of controlling the torque, and see what are the pros and cons of this method. I have listed 11 points that needs more attention when we are using rectangular wire in bracket slot. Let's review them one by one. First, dental anatomy. As you know, there are some individual variations for the shape and convexity of facial surfaces of teeth, and since bracket prescriptions are according to the average shape and convexity of tooth surface, any kind of minor or major variation of tooth anatomy can have an impact on the expression of bracket slot prescription, or in other words, the slot of bracket stands on the tooth surface in a way that is not meant to be. For example, if the curvature of the labial surface of this lateral incisor is increased or decreased, bonding the bracket on this surface will position the slot of the bracket a few degrees aberrant. Type of ligature. The next item is the type of ligature. In particular, stainless steel ligatures assure a better slot to arch wire engagement and a better torque control than elastomeric ligatures, which deteriorate rapidly in the oral environment. However, use of steel ligatures are not very common nowadays, and also using them are really time consuming. Vertical bracket positioning. As you can see, because of the convexity of buccal and labial surface of teeth, if the bracket is bonded in different vertical levels other than it is made for, the bracket slot will not be in proper angulation to create the desired third order position of tooth. There are many situations, especially in mixed dentition, when the clinical crown is not fully erupted and the clinician is obliged to bond the bracket more coronally. Please note that in order to have a truly straight wire system of brackets, the torque angulation of all brackets should be in line with other teeth in the dental arch, and the necessary condition for this situation is bonding of all brackets on the center of clinical crown point or CCC point or FA point on all teeth of the dental arch. Rigidity of the wire material can be easily seen on nomogram tables. Nomograms developed by Kusi to provide generalized comparisons of different alloys like stainless steel, M-niti, and beta titanium, and also different sizes of each alloy in bending and torsion. Please note that here we are only having the table for torsion. The left table is for stainless steel, the middle one for M-niti, and the right table is for beta titanium or TMA alloy. For the preparation of a nomogram, a reference wire is given a value of 1, and many other wires can then be located appropriately in reference to this. As you can see in this table, the reference wire is for 012 stainless steel wire here, and all other wires are compared accordingly. For example, a 17 by 25 steel wire here, a stiffness number is 12.5, and the stiffness number for 19 by 25 M-niti is 2.5 here, and the stiffness number for beta titanium is 5, which shows that if you use a 17 by 25 steel wire in 18 slot bracket to control torque, you can create force 5 times more than using a martensitic niti wire in 022 slot bracket, or 2.5 times more force compared to 19 by 25 beta titanium wire. And if you add the variable of the play between wire and bracket, which we will discuss later, the force created in 18 slot bracket is far more than this. And even a stiffness of 21 by 25 TMA wire is 6, while the stiffness of 17 by 25 steel wire is 12.5, which means more than 2 times force, or in other words, better control of third order position in 18 slot brackets than 022 brackets. To create the proper amount of moment to torque the tooth, either the force should be high or the moment arm should be long, or a combination of both. Because of short moment arm of a rectangular wire in edgewise technique, to create the necessary moment to torque the tooth, which is actually the width of the arch wire, the force needs to be quite high to create enough moment to torque the tooth. That is why the wire can expand the bracket slot. In some cases, the amount of this expansion is reported to be about 0.016 millimeter, Please note that it is 0.016 millimeter and not inches. Studies show that active stainless steel self-ligating brackets demonstrate an engagement angle of approximately 7.5 degrees, whereas passive stainless steel self-ligating brackets show an engagement angle of approximately 14 degrees with 19 by 25 stainless steel wire in a 22-inch slot bracket. So it can be concluded that active self-ligating brackets are more capable to control torque of tooth. Studies show that lingual brackets are more efficient in expressing the torque of brackets, although there is some variations in different brands of lingual brackets. There are quite a variety of different prescription of brackets in the market. For example, a speed self-ligating brackets comes in 4 different prescriptions: high, medium, regular, and Hansen prescription. You can see 2 of these prescriptions here, high and regular one. Also, Ormco company, which makes the Damon brackets, has 3 different prescriptions. As you can see, these are low, standard, and high. There is some degree of play between the rectangular arch wire and the walls of the bracket. The degree of play is quite considerable. In this table, you can see the degree of play for 2 different bracket types, 18 and 22 slot brackets. And as you can guess, the play is much more for 22 slot brackets for the same size of the wire. One of the most important items to consider is the width of bracket slot. If we consider the working arch wire for 18 slot brackets to be 17 by 25, it has only 4.1 degrees of play, while the working arch wire for 22 slot brackets, which is 19 by 25 here, has a 9.5 degrees of play, which clearly demonstrates efficiency of 18 slot brackets in controlling the torque. The EBR, or edge bevel radius, has been responsible for up to 63% of the final play between wire and slot. Edge bevel with a minimum radius of 40 micrometer is recommended so the wires do not cut the lips or cheeks of the patient. However, it should not increase more than that, since it can compromise torque control, and the reason is that as the EBR increases, the moment arm decreases, and likewise the moment. Now, after going over all the considerations of using a rectangular arch wire in a rectangular slot, let's get back to the list of different ways of controlling torque in edgewise technique and review 4 weaknesses of the first method. Let's imagine that these 2 central maxillary incisors are located side to side of each other. The left one has a lingual crown torque that we are going to correct. As we activate the rectangular arch wire and engage it into the bracket slot, the arch wire in the neighboring tooth also engage to the walls of the bracket to make a lingual crown torque, and the result is this. The left central incisor crown moves to labial side, and at the same time, the right central incisor loses its torque and moves to the lingual side. As you see, the disadvantage of this method is that the anchorage unit is the immediate neighbor tooth next to the tooth under active treatment. As you can guess from this table, it is clear that only engaging a rectangular arch wire doesn't necessarily mean correction of the torque of the tooth all by itself. If one considers the range of clinically effective torque to be between 500 and 2000 gram millimeters, this range can be attained at 22.5 to 34.5 degrees with a 19 by 25 inch stainless steel arch wire in a 22 slot bracket to generate enough moment to correct the torque of the tooth. I don't need to repeat that almost 10 degrees of this number is the play between the wire and the bracket and don't do any good in terms of torque correction. The problem is that when the teeth need torque correction, sometimes they are not in a well-aligned position or cannot be aligned enough, and hence tying a heavy rectangular arch wire is not an easy job. And the last point about using a rectangular arch wire to control the torque is the range of action. Because of difficulty in engaging the activated rectangular arch wire, and also because the activation of a rectangular arch wire is very delicate, especially if it is only for one tooth, you may need to do it several times till you get the desired result. Also, twisting the wire about its longitudinal axis and to the correct angle without bending the wire in other axes is considered a very delicate task. The second method to control torque in edgewise appliances is piggyback torquing auxiliary, which can be made of 016 steel round wire with a moment arm of 4 to 5 mm. The auxiliary arch bent into a tight circle initially exerts a couple of force on teeth. One point of this couple is here and to the lingual side, and the other point is pushing the main arch to the labial side here. As it is partially straightened out to normal arch and hooked on the sides somewhere between premolars and molars to the main arch wire. As you can see, this torquing spring has 5 arms which is placed under the main arch wire, and it has 4 connecting sides that run between the arms, and they push the teeth toward the lingual side. To prevent increase of overjet due to labial crown torque of anterior teeth, the main arch wire should be cinched back tightly, and class 2 elastics are recommended to save the anchorage. Also, please note that the main arch should be heavy enough to prevent any kind of distortion of the dental arch. The Burston torquing arch is particularly useful in class 2 division 2 cases where maxillary central incisors need a large amount of torque. The torquing auxiliary is full dimension steel wire 21 by 25 or 17 by 25 in 22 or 18 slot brackets respectively, that fits in the brackets only on the central incisors. The base arch, preferably also full dimension rectangular wire, extends forward from the molar through the lateral incisor brackets, then steps down and rests against the labial surface of the central incisors. When the torquing auxiliary is passive, its long posterior arms are up in the buccal vestibule It's activated by pulling the arms down and hooking them beneath the base arch wire mesial to the first molars. The segment of the base arch that rests against the labial surface of the central incisors prevents the crowns from going forward, and the result is efficient lingual torque of the central incisors' roots. Because the stabilizing arch wire prevents facial tipping and extrusion of the central incisors, the result is lingual root torque with optimum force over a long range. The tip edge brackets permit tipping in only one direction but set up anchorage through bodily movement in the other direction. In tip edge method, the teeth are tipped to the desired position, then uprighted by the side winder springs. Essentially, the concept for torque control is the same as using a rectangular arch in the rectangular bracket slot with the help of the side winder spring. Tip edge brackets have an accessory vertical slot that is used by the side winder spring, as you can see in this picture. The side winder spring corrects the second and third order position of the tooth simultaneously. As the root is uprighted in the mesiodistal direction, the rectangular slot decreases to its predetermined size and the full-size rectangular arch wire gradually engages with the bracket slot walls and hence corrects the torque of the tooth. The fifth method of controlling torque of tooth is the Goodman torquing spring. As you can see, it must be mounted on a rectangular wire and gets its anchorage from the rectangular arch wire. That is why the Goodman spring comes in different sizes and can fit different base arch wire dimensions. For example, these are Goodman springs which fit 16 by 22, 17 by 25, 18 by 22, and 19 by 25. And each of these springs have three different sizes: small, medium, and large. But the problem with the Goodman spring is that when the arm is exerting force on the cervical part of the tooth to move the root to the lingual side here, since it is getting its anchorage from the rectangular arch here, the rectangular arch wire is twisting exactly in the opposite way and prevents the tooth to be rotated in the desired direction. To solve this problem, the arch wire that engage inside the bracket and only inside the bracket should be rounded and made the rectangular wire into a round wire, and this should be limited only to that part of the wire that engage the bracket only, and not to more than that, because the Goodman spring anchorage take advantage of the rectangular shape of the wire to create force. In this view, you can see how the Goodman spring creates moment to correct the torque of the tooth. As you can see, if the rectangular wire is engaged into the bracket, it creates a moment that is opposite to the direction that the Goodman spring is intended to create, and that is why it is recommended to make the wire cross-section round to let the tooth rotate in the correct direction. Now let's see how the horizontal box loop works. to make torque on teeth. Essentially, horizontal box loop is a kind of loop to increase the springiness of only a segment of a heavy arch wire locally, and hence it is used in situations when the dental arch is aligned and only one tooth needs to be aligned. Let's see how it is made. As the name suggests, it is formed like a box like this. It goes up, then horizontally, and then down, and again horizontally crosses the bracket slot, and up again, and it's made like a box. As you can see, the box loop is usually made perpendicular to the line of occlusion. But if you turn it inside the dental arch 90 degrees, when you want to engage it in the bracket, it will make a couple of force and tries to torque the tooth in a labial crown torque direction. The 2 points of this couple are the segment of wire in the bracket slot and the segment of wire leaning on the cervical part of the tooth. Let's see one example of a case that needs this horizontal. Imagine an impacted tooth that needs to move a long way in an occlusal direction. Since the point of force application is labial to center of resistance of the tooth, after the tooth reaches the correct position, it will have a lingual crown torque that needs to be corrected. This patient is an 11-year-old girl with class 3 malocclusion and impaction of left central incisor. You can see the impacted left central incisor in both the panorex and also the lateral ceph of the patient. After forward movement of maxilla and exposure and orthodontic movement of central incisor, it is clear that this tooth has lingual crown torque here that needs to be corrected with horizontal box loop. As you can see, horizontal box loop or HBL here can both correct the torque of the tooth and also increase the flexibility of the arch locally to further move the central incisor in the correct position. It is a feature of horizontal box loop that is superior to the use of rectangular arch wire. Another example is the maxillary impacted canine that has been treated but again has some lingual crown torque because the impacted tooth has moved a long way down to the correct position in the dental arch. And horizontal box loop is again engaged here to correct it. Now let's see if horizontal box loop also can make lingual crown torque. In this example, when you move a tooth to the labial side, which is here a palatally impacted maxillary canine, for a long distance, since your point of force application is incisal to the center of resistance, you will lose torque, especially for impacted tooth. You don't have enough space to bond the bracket 4 or 5 millimeters from the incisal edge, and depending on the surgical exposure of the canine, the bonding position is usually more incisal and after the tooth gets to its proper position, you need to make lingual crown torque, like this example. The left picture is the patient before orthodontic treatment with the primary canine tooth in place. The right picture shows that the canine moved to its proper location, and because of too much labial crown torque, we need to correct its torque. In this example, we need to bond a bracket with vertical slot and make the main arch wire with horizontal box loop here, which is bent outwards, and also we need an activation stick made of 16 by 16 rectangular arch like this. The bend in the activation stick here has two functions. First, it acts as a stop to prevent the stick going further inside the vertical slot, and second, makes a space for the horizontal box loop to be kept under it. We can see in the next slide. As you see in the left picture, the arch wire is engaged on teeth with the horizontal box loop extending labially. Then it is rotated with finger pressure up, and the activation stick is inserted in the vertical slot to hold the horizontal box loop up and back, and hence generates the necessary moment on tooth to correct the torque. Here is the result, pretty normal torque comparing the right and left canines. As you can see here, horizontal box loop can be made like a triangle or like a square. As you can see, the left horizontal box loop is like a triangle and the right one is like a square. And here are the features for horizontal box loop. First, the horizontal box loop is suitable for single tooth. Secondly, it needs minimum force to correct the torque due to length of the moment arm. Third, more labial root movement rather than lingual inclination of crown will happen with the horizontal box loop. And fourth, the whole arch is the anchorage unit, in contrast to the rectangular arch wire in the rectangular slot of the bracket. The whole arch is the anchorage unit. And finally, minimum side effect on neighboring teeth. And the cons for this design is its time-consuming fabrication. However, if you consider that its range of action is so high that when you do it only one time, it can go the whole way, and this will compensate the time you spend to make it. Let's finish our presentation with the last method of torque control, which is the horizontal U-loop or HUL, which has a simpler design in comparison to the horizontal box loop. As you can guess, this time we have a horizontal U-loop and an activation stick that is somehow similar to the activation stick of the horizontal box loop. HUL or horizontal U-loop is only for making lingual crown torque, and let's see how should we use it. Again, we have an impacted maxillary canine tooth that has been exposed and brought to its proper position, but has a labial crown torque that needs to be corrected. The canine bracket has vertical slot and the main archwire is made of 018 with the U-loop sticking outwards or towards labial side. Then the U-loop is rotated up and the activation stick is inserted in the vertical slot of the bracket to hold back the U-loop. The force generated by the U-loop not only creates a favorable moment that wants to make lingual crown torque on the tooth, but also makes an unfavorable rotation moment that wants to rotate the distal side of canine out because the point of force application is distal to the center of resistance. That is why it is better to bend the excess of the activation stick here to distal to compensate for this side effect. I wrap up this presentation with this paper, which is a finite element study about the horizontal box loop. If you would like to know more about the efficiency and side effects of the horizontal box loop on the dental arch, you may want to have a look at this paper, which was published in 2022 in American Journal of Orthodontic and Dentofacial Orthopedics. Please don't forget to like if you enjoyed watching this video and subscribe to my channel for further orthodontic videos of this type in the future. Thank you.